audio video clear? Can I have a thumbs up from anybody? Thank you, Dr. Bhargav. Okay, so technically this is gonna be the last session of this planned rapid revision sort of thing. Initial 15 minutes we'll be discussing the previous year of keys. Followed by that, we will discuss the important points of head and neck part. Okay. Let's start with the first thing. Let's make it interactive itself, okay? So that you also don't feel the boredom and I also don't get bored out, right? This is the Osce, straight out the question. Identify the procedure which is being done in this picture. What is the beaded structure that is being pointed out? What is the advantage? And expand the Phalana terms. Every year, okay, so in every session you will be having 1 to 2 marks for the expanding of the full forms. Okay, so I'll tell what are the answers over here, what are like thoda sa doubtful cheez hai that I'll answer, and also the important points related to this kind of image that you should get a reading through. Okay, so the procedure is this is basically EBRT, right? And likely proton beam therapy. Okay, now these things are like it's not much of that key. What will be the exact answer? So if I were to answer, the answer first will be external beam radiotherapy. When you'll read about it, there's something called as dose painting. Okay, and likely this is, if you have to answer in one thing, this is proton beam therapy, right? Proton beam therapy. What happened? Okay, now दूसरा चीज, what is the beaded structure that is being pointed by the arrow over this thing? So this is basically mold, okay, and to be specific, this is thermoplastic mold. Okay. Coming to the third thing, that is what is the advantage of this technique of treating cases compared to the conventional technique? Jab bhi, like whenever you get this kind of question, the exact answer should be less dose to the normal structure leading to less toxicity. Okay. तो जो surrounding के जो normal structures हैं उसको it gives less or minimal ये causing less toxicity. ठीक है, और चौथा, अब यहाँ पे can somebody help me out? What is GTV?
Gross tumor volume.
एक बार इसको चेक करना, it is gross tumor volume और gross target volume?
Target volume, I think.
मैं भी कंफ्यूज हो गया मैं. ठीक है, इसको एक बार चेक कर लीजिएगा, ठीक है? Because I confirmed these answers from the radiotherapy colleague of mine. From there only I got this thing. ठीक है, so just check one thing. It is gross tumor volume only. ठीक है, just check it. Please check it once, right? There's no harm in checking back again. I am only correct. ऐसा कुछ नहीं है. Then coming to PTV. PTV का full form? Planning target volume. ठीक है. Then ITV is internal target volume, and CTV is basically clinical target volume. ठीक है. Now over here, what else you have to read? I'll just write in black. Please read it. ठीक है. You should be ready with 4 hours of radiotherapy. ठीक है. You should read about IGRT in brief. It's not that कि अब theory का आंसर नहीं लिखना है. So it should be in brief. That अगर IGRT पूछते हैं तो you should be writing about the basics of IGRT. दूसरा इसका भाई IMRT, ठीक है. थर्ड, हाइपो एंड हाइपर फ्रैक्शनेशन. 3. चौथा हो गया ब्रैकीथेरेपी, ठीक है. एंड लास्ट हो गया आपका फोटोडायनेमिक थेरेपी. ठीक है, तो दिस इज योर revise it once. So a question, whatever had come, I'll say that questions don't get repeated, but topics get repeated for sure. ठीक है, तो ये नहीं पूछेंगे तो इससे रिलेटेड वाला कुछ आएगा। ठीक है, कमिंग टू द नेक्स्ट पार्ट, दे आर शोइंग सम वीडियो ऑफ 14 सेकेंड्स। क्या होगा, they are showing you some video of 14 seconds. This is a basically screenshot of the above thing. Identify the clinical condition in the video. What is the etiology? Which drug reduces angiogenesis? ठीक है, and prevent the recurrence. Then they are asking any other two adjuvant therapeutic agent of the condition, and what precaution must be taken to preserve voice while surgical excision of the above lesion. ठीक है, so this is basically your respiratory papillomatosis. ठीक है, I have shared this thing again at the later part of this presentation also. So to go for the exact answer, this is respiratory papillomatosis. This is a metric technique. Okay, Dr. Saab. Dr. Sirish has shared one article. Okay. This is, एक second भाई. Okay, I'll just check what can be the difference in approach for this image. One article he has shared which is telling that this is your IMRT. Okay, so I'm sharing it in the group also. जो फर्स्ट वाला इमेज है, ठीक है.
And sir, it is gross tumor volume.
Tumor volume है ना, it's tumor volume only. Okay.
Yes, Scott Brown.
Great. ठीक, तो coming to this thing, respiratory papillomatosis, and I will see the details of it again. Coming to the drug, this is your bevacizumab. ठीक है, this reduces the angiogenesis. Okay, so over here remaining we have seen multiple number of times. To do में तीन चीजें हैं. These three drugs please revise. Bevacizumab, its cousin cetuximab. Okay, revise it first too, and then this cisplatin. ठीक है. Okay. Now coming to this thing, name the procedure being performed. What are the findings in the video, and what is forceps space, and what is the clinical application, and what is thrive. Okay, see, one thing is there, even if you don't get anything what is there showing in the video, read the questions 2-3 times. Okay, you will get some or the other hang about it, what they are asking. Okay, so basically this is showing you some foreign body in the bronchus, and they are doing bronchoscopy to remove the lesion. Okay, and what is this forceps space? So I'll say in simple words that this is increased space between the lungs, between the lung roots and the carina. ठीक है, when the person inhales. When the person inhales. ठीक है, and what is the application? That this space is used to pass forceps, right, through the bronchus to remove the foreign body. And what is the full form of thrive? This is basically transnasal humidified rapid insufflation exchange. ठीक है, तो please go through it once. And over here I'll just like to mention one more thing for you. Please read about jet ventilation. ठीक है, this is a hot topic, frequently being repeated in the theories, frequently being asked in the OSCEs also. Apart from this, please read about bronchoscopy. ठीक है, 1. Read about 2. Esophagoscopy. And how to divide it? First, you have to identify what is being carried out. उनको वीडियो दे सकते हैं कि मतलब they'll ask you which procedure is being carried out, then same indication, contraindication, complication, like we discussed how to approach any surgical based question, any procedure based question. Esophagoscope में जो क्वेश्चन पूछते हैं आपको, two types of esophagoscope, that is your Jacqueline and Negus type of esophagoscope, that you should know how to differentiate between them. Okay, now coming to this repeated question. ठीक है, दे आर गिविंग, लंबा सा यहाँ पे उन्होंने आपको 4 लाइन का दिया है. इफ यू रीड इट ट्वाइस आपका 2 मिनट खत्म हो जाएगा इसमें. ठीक है, so whenever the question is bulky, whenever there is video of 30-40 seconds, be a little bit cautious. ठीक है, because that is gonna consume much of your time. Second thing, again I would like to reiterate one, that there is no negative marks for your OSCEs, and there are point wise marks being given. Like example, इसको 1 नंबर दिया, इसको 1 नंबर दिया, इसको 1 नंबर दिया, इसको 1 नंबर दिया. ठीक है, whatever details you write in this question, you will only get 1 marks. You will only get 1 marks if you answer correctly. And if you leave these two, आपने इसमें बहुत ज्यादा लिख दिया, you keep on writing pages 3-4 points, और आपने 2 क्वेश्चन छोड़ दिए, what will happen? You will be only marked for the 2 questions. ठीक है, so it shouldn't happen that you leave any topic. So you should be crisp enough, you should be fast enough that इसको फटाफट करना है करके. A 24-year-old male came with history of blunt trauma to neck 6 months back. So there is nothing acute in that. Presented with stridor and difficulty in breathing and associated with episode of URTI. Examination shows bilateral vocal cord lying in the paramediate position and inability to abduct. मतलब abductor palsy हो गया. ठीक है, patient was planned for Cashima's procedure. So he underwent the following investigation before surgery. So the answer for this investigation is basically laryngeal electromyography. ठीक है, laryngeal इलेक्ट्रोमायोग्राफी. तो इसमें उन्होंने बेसिकली सब कुछ ही पूछ लिया है एक ही क्वेश्चन के अंदर. ठीक है, व्हाट पैरामीटर्स दैट यू असेस, मल्टीपल पैरामीटर्स है. एक नंबर के लिए आपको यू शुड राइट 3-4 पैरामीटर्स. कॉमन थिंग्स आर दैट इज द स्पॉन्टेनियस एक्टिविटी ऑफ द मसल्स, देन मोटर यूनिट पोटेंशियल, मोटर यूनिट पोटेंशियल एंड इलेक्ट्रिकल सिनकाइनेसिस. ठीक है, देन नेम एनी 2 DD फॉर दिस क्लिनिकल प्रेजेंटेशन. तो इसके DD में क्या क्या आ सकता है? बेसिकली एनीथिंग विच इज नैरोइंग द ल्यूमेन. इट कैन बी ट्रैकियल स्टेनोसिस, ट्रैकियोमलेशिया, और बेसिकली एनी DD ऑफ योर बायलेटरल एब्डक्टर पैल्सी. ठीक है, it can be there. Now they are asking, name any 2 endoscopic surgical procedures for the management apart from the Cashima's procedure. तो Cashima's में basically you remove that bulk of the cord, erythroid the cord, you remove it. Apart from that, what else you can do? You can go for endoscopic erythroid abduction, lateroplexy. ठीक है, इसका फुल फॉर्म भी कहीं कहीं पे दे हैव आस्क्ड EALA. दिस इज एंडोस्कोपिक एरिथनॉइड लैटरल एब्डक्शन. ऐसे करके दे हैव आस्क्ड, I've seen in 1 or 2 places. So in case it is there, so this is the same thing. Apart from that, what else can be asked? What else can be said? Endoscopic erythenoidectomy. What to read from this thing? Please see Cashima's procedure. This is important. Please see the image of Leichenberger needle holder. 2. Third, you should read once about Woodman procedure. Basically speaking, bilateral abductor palsy एक बार पढ़ना है. This is important. ठीक है, you should not skip it out. ठीक है, here only I'll write 2 more things. Please revise thyroplasty. It is a must know topic. Don't forget it. Everything including right from your Ishiki's classification से लेके type 1, 2, 3 and 4 ये पूरा आना चाहिए. ठीक है, ओके. एंड इसके बाद तीसरा ठीक, एंड इसके बाद जो थर्ड हमेशा इसमें आता है दैट इज योर कॉफमैन्स फॉर्मूला, दैट इज हाउ यू कैलकुलेट द विंडो ऑन द कार्टिलेज. ओके, okay, so after this thing, coming to the fourth point, this is the video otoscopy of the right ear of a 45-year-old woman who presented with significant hearing loss. There was no movement of tympanic membrane on Valsalva or stabilization. So basically, they are telling us about adhesive otitis media. So over here, you should remember two things. That is retraction of pars tensa, retraction of pars flaccida. This is which classification? Pars tensa ki name of retraction of pars tensa classification?
Spade classification.
सार्डे एंड बर्को. ठीक है, तो सेट्स ऑब्लिक सार्डे, व्हाटएवर यू वांट टू रिमेंबर. एंड व्हाट्स द नेम ऑफ आवर पार्स फ्लैसिडा?
Toss classification.
टॉस क्लासिफिकेशन. ठीक है, यू शुड रिमेंबर द ग्रेड, यू शुड नॉट मिस इट, यू शुड नॉट स्किप इट. ठीक है, while I'll just again reiterate it, I keep on saying every time, giving viva is an art. You nobody can assess what you have read in the last 3 years in just 3 hours. You have to tell the examiner. Okay, so whenever, like, suppose you get this, most of you will be getting CM long case in your viva. So when coming to the examination finding of the patient, and generally cholecystoma रहेगा या उसको retraction रहेगा, so speak from your point कि sir pars flaccida toss grade 2 retraction is there, and just give a pause of 5 seconds and wait and let the examiner give you that full toss ball. अच्छा, toss classification, tell me what is toss. So you should be like ठक 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 चारों point. अब वहां पे you should not miss it, you should not mix it कि तुमने यहाँ पे toss बोल दिया और आंसर में you are speaking sade, so that gives a wrong impression. ठीक है, so that is how please you should make up for your viva also, right? And ठीक है, ये हो गया आपका मैनेजमेंट में. we all know that this grome insertion we'll all do. Expand Mary, so we have seen this thing multiple number of times. ठीक है, middle ear risk index, this is important. ठीक है, and I generally say that जब आप examine करके finding लिखेंगे, if you have read Mary, speak what is the Mary score. So he'll ask you what is Mary, what is the implication in viva also. So you will gain brownie points from here. Apart from Mary, two other things are there: oops and spite. So please read about them also. ये आपको मिलेगा स्कॉट ब्राउन में, when there is Mary's that table is made, उसके just नीचे oops और spite लिखा हुआ है. ठीक है, now coming to one more of this kind of plot. Okay, so the answer, can somebody want to take a try? नाम क्या है इस plot का?
Forest plot.
Forest plot. ठीक है, Dr. Asta, great, this is correct answer. The answer is forest plot. I'll just tell you what are the things over here to read about. They are saying this plot is used to represent what? So basically, this is used to summarize the result of multiple scientific study that address the same question. ठीक है, नंबर 3, they are asking what is the vertical solid line represent. तो जो vertical line है, this represent no effect point. ठीक है, फिर इसके अलावा vertical के अलावा horizontal line है, तो जो horizontal line है, what does they represent? They represent more precise consistent results. And this question is also there. अगर ये आपका colored picture होगा तो this diamond is colored. Okay, most of the cases this is green diamond. ठीक है, तो ये पूछते हैं green diamond का मतलब क्या होता है. जो bottom पे है, this is basically, this shows the overall effect estimation based on whatever study you are doing, so उसके ऊपर कितना overall effect हो रहा है. ठीक है, so this diamond represents this thing. Now coming to this NPPCT का logo ठीक है, yesterday I shared that PDF of around 10-12 pages, है ना. तो read NPPCD once. इसका लोगो पता होना चाहिए, फुल फॉर्म पता होना चाहिए. ठीक है, दिस प्रोग्राम वाज स्टार्टेड इन 2007 एंड किस मिनिस्ट्री के अंडर में आता है. ठीक है, दैट यू शुड बी रेडी विद दिस. ओके, ओवर हियर टू रीड पॉइंट इज, जैसे फॉरेस्ट प्लॉट है, देयर इज वन मोर नेम्ड प्लॉट बाय द नेम ऑफ कैप्लैग मियर. ठीक है, तो इफ यू हैव नॉट रेड इट टिल नाउ, दिस इज द टाइम टू रीड इट आफ्टर द क्लास. प्लीज सर्च मार के जहां भी आपके नोट्स है उधर से देख लो. अगर ग्रुप में 3-4 टाइम्स वी हैव शेयर्ड, प्लीज रीड इट वंस. There is one more named curve with the name of Nelson Ayer curve. ये कहाँ पे देखने को मिलता है? Can somebody take a try? This is not from PSM section. Biostats का नहीं है. This is given in Scott Brown. Somebody? Yeah, Dr. Sahab, है ना? Great, Dr. Osce. This is a named curve which is seen in vestibular schwannoma. ठीक है? So these three named curves are there. Kaplan-Meier was covered multiple number of times. Forest plot नहीं cover हुआ था. I thought I'll cover it in the present session. Okay, now this is the repetition of the previous class. So it's like people who have taken the last session and you are like okay with that. If you want to log out, you can go and do your routine work. Otherwise, hang around for another 15-20 minutes. We'll finish remaining questions. Okay, so they are saying study the picture given below and answer the following. Okay, so identify the procedure they are saying. Then they are saying a full form of smile. ठीक है, तो identify the procedure में आपका आ जाएगा. This is basically hypoglossal nerve stimulation. Images from Lalwani. Hypoglossal nerve stimulation and smile का full form आपका हो जाएगा. Somebody want to take a try? Submucosal minimal invasive lingual excision. ठीक है, इट्स इंपॉर्टेंट, रीड इट. ठीक है, हाइपोग्लॉसल नर्व स्टिमुलेशन में जो मॉडल्स आते हैं केवल नाम पता होने चाहिए. नाम इसका होता है इंस्पायर 1 and 2. फिर एक एपनेक्स नाम से आता है, एक IM थेरा नाम से आता है. ठीक है, इतना बहुत है. सोर्स इसका ललवानी. ठीक है, अच्छा, इसके अलावा व्हाट इज यू हैव टू रीड. प्लीज रीड फुल फॉर्म ऑफ डाइस, DISE, ड्रग इंड्यूस्ड स्लीप एंडोस्कोपी. इसके लिए हम लोग वोट क्लासिफिकेशन यूज करते हैं, VOT, वोट क्लासिफिकेशन. ठीक है, स्माइल आपने देख लिया. LAUP, दिस इज बेसिकली लेजर असिस्टेड यूविलोप्लास्टी. देन देयर इज CAPSO. ठीक है, दिस इज कॉटरी असिस्टेड पैलेटल स्टिफनेस ऑपरेशन. कॉटरी असिस्टेड पैलेटल स्टिफनेस ऑपरेशन. सो हाँ, इसके साथ जो इससे रिलेटेड क्वेश्चन है, कॉक्लियर इम्प्लांट की जो कंपनी, कॉक्लिया न्यूक्लियस